My 68-year-old patient Margaret came to my office 3 weeks ago, complaining of dizziness and severe muscle weakness.
What was her medical history, Robert?
She had been taking statins for cholesterol control for over 5 years with no issues whatsoever.
And then something changed in her routine?
Yes. She started a health kick after reading an article about antioxidants and began eating half a grapefruit every single morning.
That sounds like a positive lifestyle change on the surface.
Except within 3 weeks, her statin levels in her bloodstream had tripled because grapefruit blocks the enzyme that breaks down the medication.
So she was essentially overdosing without knowing it.
Exactly. Her muscle weakness was rhabdomyolysis, a dangerous breakdown of muscle tissue that can lead to kidney failure.
This is why medication reviews must include dietary habits, not just pill counts.
But here is what concerns me most. Grapefruit is not the only fruit that poses serious risks for elderly patients.
In my practice in Japan, I see different fruit-related issues, though the underlying principle is the same.
Today we are going to walk through 5 specific fruits that seniors need to approach with extreme caution or avoid completely.
And we will explain exactly why these fruits become problematic as we age.
Let's start with the first category that catches most people off guard, because these fruits are considered healthy snacks.
You are talking about the blood sugar issue.
Grapes. Small, convenient, sweet, and absolutely terrible for elderly patients with diabetes or pre-diabetes.
But Robert, grapes have been part of healthy diets for thousands of years.
The problem is not the grape itself, Akira. It is the concentration of natural sugars and how quickly they hit the bloodstream in elderly patients.
So portion size matters significantly here.
1 cup of grapes contains 23 grams of sugar, with a glycemic index of 59, which is considered moderate to high.
In elderly patients, insulin sensitivity is already compromised.
Exactly. Their pancreas does not respond as quickly, and their cells resist insulin more than younger adults.
What about the fiber content? Does that not slow absorption?
Grapes have less than 1 gram of fiber per cup, which is nowhere near enough to buffer that sugar load.
So the glucose spike happens rapidly.
Within 30 to 45 minutes, you see blood sugar levels jump, and for someone on diabetes medication, this can cause dangerous fluctuations.
I see elderly patients who eat grapes as a snack between meals, thinking they are making a healthy choice.
And then they wonder why their glucose readings are inconsistent, or why they feel fatigued after eating.
Education about glycemic impact is essential.
Now let's talk about dried fruits, which are even worse because people underestimate serving sizes.
Dried fruits are concentrated sugar bombs.
A single quarter cup of raisins contains 29 grams of sugar, more sugar than a glazed donut.
And patients eat them, thinking they are healthy because they came from fruit.
The dehydration process removes water, but concentrates all the natural sugars, and many commercial dried fruits have added sugar on top.
In Japan, we also see this with dried persimmons.
Same principle. The elderly patients I treat often have pre-diabetes or full type 2 diabetes, and dried fruit can push them over the edge.
But you are not saying all fruit is dangerous, Robert.
No, I am saying these specific high glycemic fruits pose unnecessary risks when better alternatives exist.
Context and individual health status must guide these decisions.
Which brings us to the fruit that sent Margaret to my office, grapefruit.
This is where medication interactions become critical.
Grapefruit and its juice contain compounds called furanocoumarins that irreversibly block an enzyme in your intestines called CYP3A4.
And this enzyme is responsible for metabolizing many medications.
Over 85 different medications interact dangerously with grapefruit, including statins, blood pressure drugs, and certain antidepressants.
So when the enzyme is blocked, the medication builds up in the bloodstream.
Exactly. You get drug levels 2 to 3 times higher than intended, which can cause severe side effects or even toxicity.
How long does this enzyme blockage last?
It can take 24 to 72 hours for your body to produce new enzymes, which means even 1 glass of grapefruit juice can affect medications for days.
This is not common knowledge among elderly patients.
Most of my patients had no idea grapefruit could interfere with their prescriptions until we had the conversation.
Pharmacists should be screening for this.
They should, but many patients see multiple doctors and get prescriptions from different pharmacies.
Communication gaps lead to dangerous oversights.
Let me give you the most common medication categories affected: statins like atorvastatin and simvastatin, calcium channel blockers for blood pressure, and immunosuppressants.
These are medications many elderly patients take daily.
And just one serving of grapefruit can cause muscle damage, dangerously low blood pressure, or kidney problems, depending on the drug.
So, complete avoidance is the safest recommendation for anyone on these medications.
Absolutely. There is no safe amount of grapefruit if you are taking interacting medications.
What about other citrus fruits?
Oranges, lemons, and limes do not contain these problematic compounds and are generally safe.
But there is one citrus-related concern I see in my elderly patients in Japan.
What is that?
Whole citrus fruits, like oranges and tangerines, pose a significant choking and aspiration risk for elderly patients with swallowing difficulties.
That is an excellent point I was going to raise next.
As we age, our swallowing reflex slows down, and the coordination between breathing and swallowing becomes less precise.
This condition is called dysphagia, and it affects up to 40% of elderly adults.
Citrus segments have membranes that can be difficult to break down in the mouth.
And if a piece goes down the wrong pipe, it can cause aspiration pneumonia, which is a leading cause of death in elderly populations.
I have seen cases where families give elderly relatives fresh oranges, thinking it is healthy, but the patient struggles with the texture.
For patients with known swallowing issues, citrus fruits should either be avoided or modified into safer forms, like blended smoothies.
Even then, we must ensure the consistency is appropriate.
Now let's discuss bananas, which surprise most people because they are often recommended as a healthy fruit.
Bananas are problematic for specific patient populations.
One medium banana contains about 420 milligrams of potassium, which is beneficial for most people.
But not for elderly patients with kidney disease or those taking certain medications.
Exactly. Patients with chronic kidney disease cannot efficiently remove excess potassium from their blood.
Hyperkalemia, or high potassium levels, can cause dangerous heart rhythm problems.
I have had patients end up in the emergency room with cardiac arrhythmias because they were eating 2 or 3 bananas daily while on ACE inhibitors.
ACE inhibitors and ARBs, common blood pressure medications, cause the body to retain potassium.
So you were getting potassium from the medication and then adding more from bananas, and the elderly kidneys cannot handle the load.
What are the warning signs of high potassium?
Muscle weakness, tingling sensations, nausea, and irregular heartbeat. But here is the scary part. Sometimes there are no symptoms until it becomes life-threatening.
This is why regular blood work is essential for elderly patients on these medications.
And why dietary counseling must be specific, not generic advice to eat more fruit.
I tell my patients, if you are on ACE inhibitors or have kidney issues, choose lower potassium fruits.
Berries, apples, and pears are much safer alternatives with significantly less potassium per serving.
But Robert, you are not suggesting elderly patients avoid all fruit.
Absolutely not. Fruit provides essential vitamins, fiber, and antioxidants that support healthy aging.
The key is choosing the right fruits based on individual health conditions.
Let me give you the safer alternatives that I recommend to my elderly patients.
This is the practical information people need.
Berries. Blueberries, strawberries, and raspberries have low glycemic index, high fiber, and powerful antioxidants without excessive sugar.
And they are easy to eat for patients with dental issues.
Apples and pears provide fiber and vitamin C with moderate sugar content. Plus, they are satisfying and require chewing, which promotes jaw health.
In Japan, we also recommend persimmons when they are in season, but fresh ones, not dried.
Melons like cantaloupe and watermelon are hydrating, low in calories, and generally safe for most elderly patients.
What about portion sizes, Robert?
One serving of fruit should be about the size of your fist, or 1 cup of berries, not an entire bowl.
Eating fruit with a protein source like nuts can also slow sugar absorption.
That is an excellent strategy, Akira. Pairing fruit with healthy fats or protein moderates the glycemic response.
Now let's come back to Margaret, your patient from the beginning.
After we identified the grapefruit-statin interaction, I immediately had her stop eating grapefruit completely.
How long did it take for her symptoms to improve?
Within 1 week, her muscle pain began to decrease, and her lab work showed statin levels returning to therapeutic range.
Did you change her medication?
No, we kept the same statin because it was working well for her cholesterol. We just eliminated the grapefruit entirely.
And you replaced it with safer fruit options.
She now eats berries with her breakfast and has an apple as an afternoon snack, and her health has been stable ever since.
This shows that small dietary changes can have significant medical impacts.
Let me summarize the 5 fruits we discussed today that elderly patients should avoid or approach with extreme caution.
Number 1. Grapes, due to high sugar content and rapid glucose spikes.
Number 2. Dried fruits, which are concentrated sugar sources that disrupt blood sugar control.
Number 3. Grapefruit, because of dangerous medication interactions with over 85 common drugs.
Number 4. Whole citrus fruits for patients with swallowing difficulties due to aspiration risk.
And number 5. Bananas for patients with kidney disease or those taking ACE inhibitors due to potassium overload.
The safest fruit choices for most elderly patients include berries, apples, pears, and melons in appropriate portions.
Always consult with your physician or pharmacist about potential food-drug interactions specific to your medications.
If you are caring for an elderly parent or relative, review their fruit intake alongside their medication list.
Small changes in diet can prevent serious medical complications.
Now I want to address something important. This information is educational and based on clinical evidence, but it is not personal medical advice.
Every patient has unique health conditions and medication regimens.
Before making any dietary changes, especially if you take prescription medications, speak with your healthcare provider.
They can assess your specific situation and provide personalized recommendations.
Blood work can identify issues like elevated potassium or blood sugar problems before they become dangerous.
And pharmacists are excellent resources for identifying food-drug interactions.
If you found this information valuable, share this episode with someone over 60 who might benefit.
Many elderly adults and their caregivers are unaware of these fruit-related risks.
Leave a comment below telling us, were you surprised by any of these fruits on the list?
And which fruit do you think poses the biggest risk for elderly patients?
Your engagement helps us understand what health topics matter most to you.
We will continue bringing evidence-based information to help you and your loved ones age healthier.
Remember, aging well is not about restriction. It is about making informed choices.
The right foods support your health, while the wrong ones can interfere with your medications and well-being.
Thank you for watching, and we will see you in the next episode.
Stay healthy and stay informed.
One last critical point. If you experience sudden muscle weakness, irregular heartbeat, or severe digestive issues after eating fruit, seek medical attention immediately.
These could be signs of serious food-drug interactions or underlying health problems.
Your health and safety are the priority.
Until next time, take care.